Hey y'all, this is King and I am officially back with the Trans Discussion 2. This is for the trans men only. This is tips, advice, and a bunch of stuff you're going to need to know if you are searching and looking to start your transition. This is really for new beginners and new brothers who are taking the steps or want to know how to take the steps to begin their transition. First things first, I want to welcome all of you, all of my brothers, young and old. You're never too old to actually be your true self, and I want y'all to know that my inbox is always free on Facebook at Last Name Matthews. My DM is always open on Instagram at Reds Inc. That's 2Ds _ and I am always willing to give advice and more information if I forget, and if you have any questions ever. Knowing you are transgender, so knowing you're transgender could stem from a lot of different possibilities, between the body dysphoria, where you're not comfortable in the body that you were born in, or you have trouble with the body that you were born in, and just accepting, what you cannot change at the moment. Also, doing things that people would not necessarily say you should do, from being aggressive, playing sports, from being masculine, cutting your hair, and so on and so forth. But those are a couple signs that shows you that you are trans or could be trans if this is for you. Here are some tips on how to get started. You want to start searching for LGBT clinics in or around your area, and you want to make sure that your insurance covers these clinics. Now, if you don't have insurance, when you go to these clinics, you can apply for insurances. If you go to certain hospitals, they will have tables and booths set up where you could apply for insurance. Your basic health care should come from your city or town that you are in. If you need extra for your co-pays, look into that as well. If you cannot find an LGBT clinic in or around your area, there's also Planned Parenthood. They do give testosterone injections, I think gels, and also etc. We will get into that later on in this video. Now, to start testosterone, you're going to need to see a psychiatrist and a therapist in order to get them to say that you are eligible and mind ready to start this process and this journey. You're going to take the next step and go and see a doctor. The doctor is going to give you information about birth controls and other things to stop your period. They're also going to tell you that after a while, the testosterone will stop your period. So you do not necessarily need to take birth control or any other substances if you are going to take testosterone. Now, there are different types of testosterone, including injections, which I take. I'll be happy to show you how you do that. There's also gels, sprays, and creams. I've never used either or, but I know a little bit about all of them. Before I started taking injections, I was taking testosterone boosters to elevate the testosterone in my body, called GAT, that is G-A-T. It is in a white bottle with a blue label. You can also find it at Walmart. Injection spots are usually in your muscles. If you are thicker, you could put it in your stomach, your lower stomach. You could put it in your thigh, or you could put it in your gluteus maximus, which, is, I hope everybody knows, it is your butt. I put my injections in my thighs. I do it every 2 weeks, and I do it one leg at a time. So I do every other leg every other week, if that makes sense. Now, on to what is cheaper. I've heard that the gels and the patches are cheaper than the creams and the injections because they come in lower dosages. So low dose patients won't necessarily have to pay anything out of pocket or out of any outer costs for their prescriptions. Okay, y'all, so now there are cons to taking tea. There is irritation that could come from the bottom growth, where you will be red, you will be sore due to bottom growth, and usually when your period is coming or is supposed to come, you will have severe cramping literally in that area where your bottom is. Then there is itching that comes from the hair growth. I get hair on my back, on my legs, everywhere. I'm literally hairy. Then there's acne that also stems from hair growth and not washing your face. You should wash your face regular. Use face oils and creams There's also sore throats that comes from your voice getting deeper. I will give those with the list of remedies and stuff like that, with tips and advice. Another con to tea is actually being misgendered. During your early stages, you will be misgendered a lot. You will be misgendered if you don't have the right hair growth or the right shape, or if you just have a feminine face in general. You are more likely to be misgendered. Okay, and I can't forget about the sort of pro-con horniness. Testosterone makes you very, very, very horny. You will have mood swings also. They might be up and they might be down. You might have less emotions and you might have more emotions depending on the person and how much tea you're actually on. Now, you have to evenly distribute the tea. You have to work out regularly. You have to eat healthier and you have to take care of your body, mind, in general. So, yeah. If you do not have a partner, like I said, masturbation works wonders, especially if you're going for the more manly look down below without necessarily having to have surgeries. Pump it out, my brothers. Pump it out. Now, here's to before surgery. Before surgery, you want to research and review your doctor's clients and if they have any pictures and videos of any of the stuff that they've done. Second, when you go for these appointments, you want to ask for a consultation, not a exact appointment, because you want to talk to your doctor about the procedure and the steps that it takes to get the perfect chest for you. So these surgeries will require 2 letters. Yes, not 1, but 2. You will need a letter from your doctor stating that you are physically fit and ready for this procedure and you have been taking testosterone for a certain amount of time. The second is from your therapist stating that you have the right state of mind to go through this procedure and the support behind you to help you get through it. Now, if you cannot get these letters, you should ask the clinic if they have a psychiatrist or a therapist on staff. Then you will talk to them and they will help you get the letter if you have an outside therapist who is not willing to help you get the letter and the requirements you need to have these surgeries. Yes, I'm going to say this again. You need insurance for these surgeries. If your insurance does not cover all of it, get a second insurance. Get insurance applications and ask for payment plans. I talked about payment plans in my awareness video. Please make sure to go and check it out if you have not done so already. When you go to this appointment, make sure to ask lots of questions. See the types of surgeries they offer and give to patients of a certain size, your size, if applicable. They're going to give you advice on chest compressions and what to do to get your chest down. They're most likely going to say binders, workout shirts, and then, of course, that is to work out your chest. Now, you could do a bunch of different workouts, including sit-ups, push-ups, incline push-ups, bench presses, and a bunch of other things you could do to work out your chest, including yoga. The second appointment. For some, the second appointment is just a check-in to see where you're at and your decrease in chest size. Or for those who have worked off the fat and the muscle they needed, it would be booking your actual surgery and what dates would be great for you. Your doctor will then talk to you about painkillers and which ones would be right for you. Personally, I would avoid opioids because they are very addictive and they could lead to addiction and suicide or overdose. I would stick to the basics, Motrin and ibuprofen. Those are great and they work just fine and it will give you a high dosage. Now, once you book your appointment, your doctor will give you a prescription for the painkillers that you desire. Also, they will tell you that you cannot take testosterone injections 2 weeks before or 2 weeks after your surgery. So to keep your T levels up to par, you could then take supplements and vitamins made for men with testosterone boosting qualities to help you stay on track with your T levels. That would be a great start to building your muscles before and after surgery. If you are or you aren't on T yet and you want to discover T and what you have inside your body, because let me tell you this, all females, all people who are born female at birth still have testosterone in their body. All men, all people that were born as men still have estrogen in their body, although those are basic generics that come in the opposite sex, we all still have the component in our bodies. Now, in order to have that testosterone in your body, I suggest working out on the regular. Take supplements and eat foods that will help you build your testosterone in your body. Broccoli is a great source. Almonds is a great source. We have different kinds of meat that is a great source of protein and testosterone building. If you have more questions, I am very happy to answer and give you more advice on diet. Now, here are some remedies for healing and pain after surgery and some other remedies that will help you during your process. Now, you're going to start with tea for your sore throat and anything that may bother you in your chest area for congestion when your chest is tight, because it will sometimes feel like that. Theraflu is actually a good cold tea that helps with pain and other qualities that may make you feel sick. Next is oils and scrubs that will help you during this healing process. Healing oils such as bio oil and essential oil will help you with the scarring. Scrubs will help you with the dead tissue and the scarring, and they will help you give a more better and defined look when you are done healing after chest surgery. To help with the pain and motor function, I believe easy yoga and light stretching should help build muscle and build character in your chest muscles, and also help you get back to work if you have a job or are looking for work to get outside and get there. After your surgery, your first appointment after your surgery, you will see the doctor again, and that will be the first time you will see your chest, because they will be taking off the bandages for you to properly change and show you how to drain and take care of your wounds. So now, depending on which surgery you get, I had a double incision mastectomy, which I needed drains therefore after surgery. Now, the tubes and drains you then have to clean and take care of yourself before you can go to the doctors and remove it. This next clip will tell you how to change and address those tubes in a hygienic manner. These drains are clear tubes that come out of the side of your chest and have two bottles with tops on it that are unscrewable. These drains also come with 2 cups for you to measure the drainage and blood supply that comes out of your chest during this time. During these drainings, they give you these containers to keep track of what is coming out of your body, so you can then show your doctor, so when you go back, he can take the drains out if needed to take the drains out or to keep them in. If you do not do this, they will not know if you are ready or not to actually have the drains pulled out. Now, if your surgeon doesn't tell you this, I'm going to tell you this. Changing your bandages does not necessarily mean every time you take them off, you have to put another one on. Let your chest breathe. You have to let your chest breathe at some point. It is okay to take off your bandages and walk around. Try not to hit the tubes or move them too much, because it can make the incision larger than what it needs to be. So technically, there's no guidelines or book to read on what to do after you have finished top surgery. But for your attire, I suggest wearing bigger or bulkier clothes than you would regularly wear, because the tubes are literally right here. So you don't want nothing too tight, and you don't want to irritate your skin by having them so close on it. So bigger and bulky clothes should do the trick. So your final and last appointment should be removing your drains. It should be a very quick appointment. They might ask you, what would you like to have? Chest strips or adhesive. They're just to help you keep the stitching aligned and help your healing process be even better. Process to bottom surgery. Now, of course, what you want to do is search for doctors in your area, surgeons. If you cannot find one in your area, ask your clinic or your Planned Parenthood for a referral list that they have for plastic surgeons in your area or in the outskirts of your area. And then check your insurance. Insurance is important if you do not want to pay out-of-pocket costs. These surgeries can be very expensive and out-of-pocket for a lot of the minority community. And again, you don't want to ask for a strict plastic surgery appointment. You want to ask for a consultation, because you will then get to meet and talk to your doctors about options and how everything works ahead of time. If you do not You probably won't be properly informed ahead of time. They'll review your insurance and most likely set another appointment for you to have the surgery. Search the surgeries you are inquiring about. If you haven't done so already, please go back and watch my awareness video and get informed about the surgeries and the procedures it takes during these bottom surgeries. Requirements are basically the same for top and bottom surgery. You will need 2 letters of confirmation, one from a health physician and one from a therapist or psych physician that you have been seeing. One of the only differences from top to bottom surgery is that you are actually enhancing a part of yourself. Now, depending on which surgery you want, if you haven't chosen one or don't know what they are, please go back to my awareness video that I posted. The myoplasty, they'll work with what you have, and the phalloplasty is not for everybody. You will need a certain amount of growth to do that surgery. Now, for my guys who are actually trying to get a bigger junk in the pants, I'm talking about your own shit. Masturbation and pumping works wonders, whether it be for yourself or for surgery. You could start by getting a small clitoris pump. Then you will go to a trans pump. Now, a trans pump is a smaller version of a man's pump. That's all it is. It's about maybe 4 inches and 3 inches thick, with a silicone tube under it to place, your dick in, and then you pump as you would if you were a man. Then there's those who might not feel comfortable, who are touch-me-nots, etc., whatever, whoever you are, dude, who would rather packers and prosthetics. There is a difference between packers and prosthetics. Like I said in my awareness video, if you haven't already watched it, packers are more like gummy dicks, while prosthetics are more realistic and they have an adhesive skin and they come with adhesive for you to place and actually appear on your body instead of just having the look. If you have a partner or multiple partners, please practice safe sex before and after, during, whatever. Practice it. Use condoms. Use dental dam, whatever you need, because you do not want an infection, a STI, a STD before the surgery, because the blood supply may be contaminated and you will be terminated or rescheduled until your body is back to top-notch health. Sex marker change. Yes, here we go. Now, in order to get your sex marker change, you will probably be required to have 2 letters. Again, one from your doctor and one from your therapist, stating that you are in the right state of mind and that you have been going through this journey to become a male. And from the doctor as well, stating how long you've been on T, and so on and so forth, to then bring these documents to your local courts. Now, the letter from your doctor should immediately look something like this. I went to Cal Lord, as you can see here, which is based in New York City, and anyone who is in that area, I advise you go there. It should have several stamps at the bottom. I don't know if you can see it. See the stamp right there, it's a stamp right there, and a signature right here. That shows the people that you are very serious and that this is authentic. Changing your name might be a little bit more difficult than changing your sex marker. Now, changing your name, you will need to petition for a name change. Although there are websites and lawyers that will help you only in certain communities that will help you change your name for absolutely nothing, petitioning for a name change could be very pricey. It could be high or it could be low. Now, that depends on the state and your age. After you have officially paid off that petition to change your name, you want to take that paper and go to your local Social Security office. There you should be able to change your name with no problem. If you have changed your name before going to the birth certificate place, bring your updated Social Security card along with your old birth certificate if you have it to prove who you are, or your ID to prove who you are. Make sure to get a money order, which is most likely what they'll take, because most of these places do not take cash. Get a money order. It might be a little extra, but now, your local court is basically where you go for a lot of these things, for also changing your birth certificate or updating it. Now, after you've done all that, To update all your information, go to your local DMV. Whatever city, borough you are in, go to your DMV, bring all your documents, your new updated documents, no old ones, and smile for the camera. Dressing for dysphoria. Now, I know that may sound a little weird, but the way you dress can actually help with the way you look at yourself in the mirror and how you feel about yourself internally. You want to start by what makes you feel comfortable. If you like skinny jeans, wear skinny jeans. If you like baggy clothes, wear baggy clothes. Shave your hair. If you like a low cut, keep it low. If you need your hair done, you get a nice flowy look, a men's look, and rock it like that. But dress to your comfortability and don't let anyone else tell you what to do. To help with your dysphoria, I suggest wearing packers and binders if you have not had these surgeries. They will help you look and pass in public. Yes, I say wear what you please, but if it helps your dysphoria, wear men's clothing. It could be men's skinny jeans, it could be men's whatever. You could wear a men's button-down Hawaiian shirt for all I care if it helps with your dysphoria. Don't let the way people look at you affect what you put on your body. Set trends for yourself and set trends for others. Do not follow trends, even though some of the trends I set are pretty legit. Always try to be yourself in the long run. One other thing for the minors that want to transition but can't because of parental rights. Listen, you do not necessarily have to take to begin your transition. You can start by getting supplements and testosterone boosters, vitamins for men. Yes, that will help boost the testosterone that you already have in your body. You can find these stores at a vitamin shop, GMC, anything that sells vitamins, Walmart, Target, CVS, Dwayne Reed, Rite Aid, whatever you need, you can most likely find it at these places. You can get supplements. Look for testosterone boosters. They will help you with the testosterone that's already in your body. You can work out to enhance that when you're taking the supplements and the pills. You can also use powders if they have it, but pills usually work best. I use GAT, that is GAT, white bottle, blue label. Now, that's all I have for you for the trans discussion part 2. For trans men only. If there's other topics you think I should touch base on, please be sure to leave a comment, or you can hit my DM privately at any time at Latane Matthews, and or on my Instagram at Reds Inc. That's with 2 D's _ I am available 24/7. TransMan out.